in this journey of life that we're having. But today, the topic of supporting your partner during pregnancy, it's important because it's not a one-person show. It's something where having support, we have noticed, bring about such wonderful and better experience for the incoming mom during her pregnancy. And this is just a brief guideline, and it's very difficult to incorporate all the different medical aspects as well as the physical and emotional aspects of what one is going through. So I definitely encourage everyone also with the resources that we have in our offices, with our providers, as well as online. There could be a lot of information out there that could be overwhelming, but getting some of that information and understanding that information and bring it into the office and bring it into the provider. And what's wonderful at Valley is that we also have a portal, so asking questions, we would definitely get back and try to answer it as soon as possible is helpful. So let's begin on this presentation. I would like to start off mainly first getting an understanding on what is her experience, and we break down pregnancy and into trimesters not because that's how it is. Pregnancy is a dynamic flow from conception to delivery, but these terminology, all this is broken down to have a system of understanding both for as a medical provider as well as the patient. And and understanding that every woman's pregnancy is unique and understanding that common experiences will help the partner respond better with empathy rather than being confused in what's going on. So it's common, we understand, when we get pregnant, some may respond fine, but some of the common experiences that we experience are the morning sickness, the fatigue, headaches, tenderness of the breast. Many may describe this as having the flu for many, many weeks. And it's a tough introduction for a body experience in pregnancy. Um, Once we get out of the first trimester, I get a lot of feedback from patients saying, doc, the morning sickness has gone away. I feel great. I can eat again. I can move, get out of bed, do my common things that I used to do. We call that the golden period in the second trimester. But as the belly bump shows, then we start getting a little bit more complaints of pain, discomforts with movement. And then more of the complaints that we see and the frustrations are in the third trimester, where we start seeing increased back pain, swelling, more urination frequency, hemorrhoids that somebody may never have had before, heartburn, something that somebody may never experienced before, changes of the body, stretch marks, where some may not like and find it frustrating. Uh, Someone who has slept wonderfully have now have issues with sleeping, and these are the common concerns that we try to address, usually preconceptually too, and that's important, but during pregnancy as well. Now, one of the beautiful aspects in pregnancy are the hormones that play a role, are common hormones that most women have had experiences with, from going through the first period in life, going through menstrual cycles, the roles of estrogen and progesterone. All these are common effects that patients have had a little bit of intuition to, with the mood swings and the cramping through menstrual cycles. Um, and these effects are exemplified even more, unfortunately, in pregnancy because of the level of hormones. So understanding what the roles of what hormones play and how the patient is reacting to these hormones can help the partner uh, have some better understanding of what they're going through. Um, so we got to understand, what is the cause of the fatigue, the morning sickness, the mood swings, the food cravings. Uh, all this is a rapid growth of hormones that we see. Um, Mainly the estrogen and progesterone are the main drivers of this. The other hormone that's establishing the pregnancy is the human chorionic gonadotropin, or HCG. That is the main driver of the morning sickness. But these hormones are more of the main players, and we'll talk a little bit about them. Progesterone is a major player in the beginning of pregnancy. It helps maintain the pregnancy in the beginning before the placenta matures and takes over. It's an important hormone to help relax the uterus. It helps prevent early miscarriage, but it also contributes to that tiredness feeling and fatigue. And it's primarily done where progesterone is converted into some sort of neurosteroid in the brain, which contributes to that. Progesterone is also known to slow down gut motility, and by slowing down the gut motility, you decrease the transit time of food and gastric juices, and this plays a major role in the bloating, the gas, the heartburn, constipation. It also relates to food retention, so you feel a little bit more swollen, you get more bloating. But the progesterone's there to help prepare the breast as well. It stimulates the mammary glands for future milk production, and this incorporates into even more breast tenderness. And then the mood. We know that progesterone also plays on the serotonin and dopamine pathway in the brain, and you get these emotional fluctuations, increase of sensitivity, fatigue, anxiety, and this is all because of the surge of progesterone. Um, and even before pregnancy, women have these sensations through their cycles. Some may have a little, some may have more, and everybody's different. But again, this gets all exemplified in pregnancy when we're getting literally 6 to 10 times more hormonal levels in pregnancy, which is not seen before. Now, hold on, where is it? Now, the other hormone that we see is the estrogen effects, and this is also vital and essential for the baby's development. We know estrogen promotes blood flow. It helps develop the placenta by increasing vascularization and to help bring the connection between mom and baby. So it's very important in nourishing the baby, but it does have its side effects. Now, estrogen, we know one of the best side effects a lot of patients say are the increased hair growth, thicker hair, the skin becomes a little bit more radiant, and a lot of the estrogen is what contributes to that pregnancy glow. But with that increased blood flow, it increases the breast enlargement, milk glands again for development, and this causes even more tender breasts. It's known to cause swelling. Mucous membranes get swollen. A lot of patients may think they have a sinus infection, but in reality, it's a hormonal effect on the nasal passages, and you have a stuffy nose. The urinary frequency is increased because the kidney is processing more of the fluids due to the estrogen effect. And then also the uterus is putting pressure on the bladder. So all these rapid rise of estrogen and ECG also increases the effects of nauseousness, vomiting, and even sensitivity and food aversions to smell. As we move on to the second trimester, uh, the hormone HCG starts plateauing and then starts to drop. And this is where the golden period of feeling and sensation occurs, because with this drop of hormone, you can start eating better, the nauseousness goes away, the aversions to smell, food, and taste usually goes away. Uh, but but still the estrogen progesterone is still continuing to rise, all in preparation for breast milk production and baby's development. It's also where estrogen is vital in triggering the development of the baby's body and cortisol. Now, we may associate cortisol as a stress to our body, but it's very crucial for the fetus to develop its liver, its lung, and other organs. There's another hormone that we normally don't see except in pregnancy, and this hormone being produced at the time in the second trimester is called relaxin. And it's exactly what it means. The hormone, it relaxes the muscle and joints. And in that, with that relaxation, you start getting clicking of the joints, the hip, the pelvis, the muscle. Um, but this is all in preparation for the baby delivery. But with the ligaments, some patients have extreme discomfort, and we need to be attuned to that. Relaxin is one of the major drivers in softening the cervix. Uh, Another hormone that we may not see except in pregnancy is the melanocyte stimulating hormone. This hormone is produces melanin, which is the main driver that gives us the pigment to our skin, our hair, and our eye color. But in pregnancy, this appears in different forms. The most common that we see is the pregnancy line, or what in medical terms we call the linea nigra, which is a dark little line that goes from your belly up to your belly button. The nipples start darkening, moles and freckles start darkening. You may have melasma or a mask around the face. These are all common in pregnancy, but it may produce a discomfort because it changes the body and the partner may not feel good about it. And these are the things we have to be aware of. And luckily, most of this does go away after delivery. In the third trimester, estrogen tends to peak, usually around 32 weeks in pregnancy, and and with the higher levels of progesterone, again, 6 to 10 times higher than before pregnancy. It's very known to get more swelling around the feet, ankles, the upper extremities. Carpal tunnel is a very common complaint in the office related to swelling. It makes it harder to walk and work and just do common chores. Progesterone also starts to peak around the same time, and we see an increase of acid reflux, heartburn, unable to sleep properly, lay flat. All this because of the relaxation effects of progesterone on the esophagus, the sphincter, and consequently, yeah, the food, the acid, everything starts going up into your throat, and it just doesn't feel good. A hormone that starts increasing at this time is prolactin, and it's exactly what it sounds like to help lactation. And this is where now the milk glands get stimulated the most and starts producing colostrum in preparation for milk production when the baby's born. Another hormone that starts getting activated is oxytocin. And amazingly, we as in the medical world, we do not know what triggers labor. We have an idea of a few of the hormones that play, but we don't know exactly what is that switch. But oxytocin starts getting produced, and it helps release something called prostaglandins, which allows the cervix to get even softer as well. But it's also a contributor to the contractions. And what the most common complaint we get is the abdomen or the uterus tightening. This is something we call Braxton Hicks. They're not painful, but they could be uncomfortable. And it could be localized to one area of the belly, or it could be the entire uterus. Now, as this uterus is expanding by the ninth month, the baby, the uterus, everything pushes the contents of the abdomen upwards. That includes the stomach, your intestines, the liver, the diaphragm. All this is being pushed up, causing increased shortness of breath, the heartburn, as we discussed, and the digestive issues. So you're going to get constipation, hemorrhoids, swollen feet, lower back pain, it's hard to sleep. You can't find a comfortable position. It's hard to move around. It's hard to get in and out of bed. It's hard to get up off the toilet. go up and down stairs. I get having to go to the bathroom frequently, all that. And on top of that, in the third trimester is when we start maybe seeing potential pregnancy complications from preeclampsia, hypertension, diabetes in pregnancy, or even risk of preterm labor. All this can contribute to anxiety and difficulties for the pregnant partner. Now, this is a good time and it's useful and it's have understanding the healthy tips during pregnancy to help keep your partner comfortable. And this is where when we talk about after understanding all the medical terminologies and these changes of the body, what can you do as a partner to help? And we know encouraging your partner to take frequent breaks, reminding them to elevate their feet as often as possible to help reduce the swelling in their lower extremities. Uh, Buy them some well-fitted, comfortable shoes. Um, Invest in a long, comfortable pregnancy pillow to help support the back and the side as they sleep for the knees as well. Um, Even encouraging them to maintain some regular low-level exercise. Swimming, if you have access to a pool at a gym or something, can really be beneficial in pregnancy. It relieves the pressure off the joints and it helps relieve that back pain. And there's a wealth of information enrolling in prenatal classes, learning about various types of labor. It really helps reduce the stress in pregnancy. So definitely encourage that. And then understanding where the hospital is, packing the hospital bag and keeping it handy, all very important. Um, so again, the different stages of pregnancy, the weight from in the first trimester where you don't see or feel anything to literally an average weight of 8 pounds of weight that you're holding on to and moving around, it can be quite challenging. So it's an emotional journey, okay? And a lot of thought processes are going around for during the entire pregnancy. You have anxiety and worry, uh, common questions your pregnant partner may be having. Is my baby healthy? Will the labor go smoothly? Am I ready to be a parent? Are we financially ready? All these anxiety and worry is constantly going through your partner's mind, and even as a couple, it goes through. Vulnerability is common. Your pregnant partner might have been very independent, and all of a sudden they're dependent on others, as well as losing control of the body. All this can be overwhelming, and identity changes. The body's changing. What I explained with the linea nigra, the stretch marks, the swelling, the sense of self, and all that is transforming simultaneously. So these hormonal fluctuations intensify these feelings. And as a partner, your validation and patience are more powerful than any attempt to fix your emotion. The partner's not there to fix things. It's more it's more advantageous to validate it and be patient. The emotional support during pregnancy is vital. That support helps reduce the stress, the anxiety, the depression. It promotes a better maternal and fetal health outcome. It helps prevent postpartum issues, and it helps create a strong mother-baby bond. It is also known, we know from studies, that a good support system has helped improve even the brain development and long-term resilience of the child. So being there for as a support person in that position will be very vital in reducing anxiety, depression, and stress. It improves the sense of normalcy and positivity for your partner, and we know it has shown to reduce and even prevent postpartum depression. We've seen that a happy, healthy mom has shown to help boost the child's brain development. It has helped improve the mother-infant bond through the emotional support and help develop a strong, healthy bond. And long-term study have shown that the child does much better. It's more resilient, is a less reactive child. However, why partners feel helpless? Well, one of the reasons why I introduced the hormonal plays in the beginning of pregnancy is to maybe give that partner a little understanding because there is an information gap. We weren't taught what to expect, how pregnancy influences daily life. We weren't taught that in school or in college. It's just thrown at us and when the time arrives, then that's where we look at, oh, where do we get our information from? So there is definitely an information gap. Some may have a fear of making mistakes. You may be worried as a partner of saying or doing the wrong thing that may make her feel worse. And then sometimes we fall in that fixer trap. Like, I want to solve that problem. I want to know, I can fix it. And really, that sort of mentality is not probably the best approach. Support is known to be a far better way. So, a key thing to remember is that as a partner, your presence and effort matters more than perfection. Your partner, she needs a partner, not a superhero. So we're not it's a very good way of thinking. Like, hey, okay, I may not be able to fix it, but I'm here. I'm there to listen. Now, how do we transform helplessness into action? Well, educate yourself. So I try to get a little information out there about the hormones at play and the different trimesters of pregnancy, and that should be hopefully encouraging to understand. But read the pregnancy books, attend the classes. There's a lot of wealth of information on YouTube. Um, and then research what's happening each week in pregnancy. Remember, knowledge does build confidence, and that could be helpful as a supporting partner. And the key, not just in pregnancy, but overall in relationships, communicate openly. Ask, what can I do to help today, instead of guessing. Listen. Listening is far more important. It's very key. And then don't be there trying to solve everything. It's more of listening, try to understand. And one of the important facts is try to be persistent and consistent. Show up at that appointments. I know it's difficult with work and the hours, um, but it's very enjoyable when I see both partners there at that office visit. And that helps, and I feel like it's a good steady support system. And if you can do that throughout the entire pregnancy and even more, will be an amazing feeling and transformation. Now, what else can we do uh, for daily life support? And this is vital uh, during her journey in pregnancy. So around the house, think about taking over the physical demanding chores. Handle the grocery shopping and the errands. In the home, try to keep the areas tidy and organized and manage overall the household scheduling. That could be a wealth of help for your pregnant partner. Comfort and rest is important. Get those pregnancy pillows for better sleep. Maybe make that warm bath when she's uncomfortable. And yeah, the foot and back massages are key to help reduce the pains and changes that the body's going through with the hormonal changes. And then create a calm bedtime routine. So the sleep is very important throughout the pregnancy. Now, the emotional and medical support are vital. I try to attend those appointments, uh, be present, for the ultrasounds and the checkups and those important consultations. Take notes, ask questions together, encourage that rest, help her prioritize the sleep and relaxation, create the space for naps and stress-free moments. And what's exciting is, celebrate those milestones, make special moments, like that first heartbeat. I always love it when a patient comes in and we hear the heartbeat together. I tell them record it. It's a special moment, to have recorded. And a lot of patients do like that and they feel happy. So it's a very, the kicks, the first time you feel a kick together, that's a special. So these are celebrating milestones that does help. But remember, the most important thing is showing up consistently. Your partner needs to know you're invested in this journey together, right? So that's a key thing to keep in mind. So what are we preparing for in pregnancy and beyond? Um, understand the hospital logistics. Get that bags packed. Usually, I tell my patients around 36 weeks. Uh, get get the important things together. Buy that extra charging for your phone. Get those snacks ready. The blanket, maybe a personal pillow. All that is important during the labor and delivery process. Um, have that birth plan discussion. Uh, her thought and ideas of actual delivery and how it's going to be maybe completely different than what the partner may imagine. So have the discussion of what you see your birth plan as, and talk through the preferences for labor and delivery and understand her wishes, because when the moment of labor comes, um, she may be bewildered, stressed, the pain. So you have that understanding as a partner. You can be there as an advocate, so you could talk with the nurse and the physician. And then plan for postpartum, because it's not just the pregnancy and delivery. Life is then a lot more. The journey then begins at birth. And that planning in a postpartum is most crucial, because it went through a stressful time of pregnancy and delivery, and the body is drained. And that is where I see it's very important for the partner to be there to help in organizing the meals, child care, preparing for that recovery ahead. So remember, preparation reduces anxiety. It ensures that she feels well supported during the most vulnerable time in her life during this period. So, key reminders for success: listen more than you speak. Sometimes she needs to vent and not receive advice. Active listening is often the best support. Practice patience. We know these hormonal fluctuations. It affects the mood, it affects the energy. You need to respond with understanding, not frustration. Stay flexible. Pregnancy symptoms and needs, they change on a daily basis. You want to adapt your support to what she needs at the moment. And then remember, take care of yourself. A partner, you can't pour from an empty cup. You need to also look at over yourself in a physical and mental health capacity. And remember, you've got this. Supporting your partner during pregnancy, remember, is not about being perfect. It's about being present, informed, and to be caring consistently. And remember, every small action matters. Every moment of understanding counts. Your effort to be a supportive partner is already making a difference. And remember, start with one small change today and build from there. And I know you're going to be an amazing support system. Yeah. Any questions?
Fantastic. So we did have one question. If anybody else has questions, please throw them in the Q&A. We have a little bit of time to answer some. The first question that came in is, can you go back to the average measurement slide when you get to the end of this presentation? That was, I think, towards the beginning.
Um, this one?
Average measurements.
Um,
Sure. Move that up for a bit. Um, in the meantime, while some questions I hope come in, I will ask a few. What signs of postpartum depression or anxiety should a partner watch for?
well, one of the most common signs is detachment from your baby. Where the where we see is, I don't want to hold the baby. That's where we see a warning sign. Um, usually that is a trigger of something maybe going on. Being not interested in the milestones of like changing the diaper, maybe even encouraging and breastfeeding or feeding, and it starts building, and it could relate to arguments. These little tidbit signs could be warning signs that postpartum depression is occurring, and you don't want to be as a partner to argue, but to inquire, is everything okay? What can I do? I'm here for you. And that's important. And then when things are seeming to unravel, and that's when we should definitely seek attention, either come here to the provider or sometimes say go to the emergency room if it's very severe. But these are the things we see, and we should pay attention to.
Thank you. How can a partner best support breastfeeding or feeding choices?
How can a partner, what was that?
Sorry, how can a partner best support breastfeeding or feeding choices?
Okay. Well, um, one is to first understand and educate about the choices. Um, First is because breastfeeding is a stressful period. It takes a toll on the body. Um, you're holding a newborn, and the crying and the stress after delivering, and it could be a bond for a lot of people, and they find it wonderful, but others may find it extremely stressful, where you may not be producing enough milk, and the infant is not being satisfied with enough nutrition. So the support system is key, and it's actually a very good question in the sense of what can we do. Um, One is expectations, and yes, breastfeeding is we know is a vital piece of helping in nourishment. But I'm a type of provider where I said, don't let that itself be the stressor. If you find yourself more stressed in breastfeeding, you find yourself that it's not coping well for you, then it's okay to get formula. Formula is fine because it's not a taboo or anything. Of course, we encourage breast milk production because, and feedings, because we know it does have the benefit of bonding and decreasing sickness for the newborn. So the things that the partner can do is first educate themselves a little bit about breast milk, but also educate about the pains and what the mother is going through, and then understanding the formulas and participating in feeding. Sometimes you can say to the partner, we will collect the breast milk, and at night you can sleep, and when the baby is crying or awake and needs a feeding, I can use the collected breast milk, and I can feed the baby night. So these are good ways of encouraging and helping as a partner.
As a partner, what are some specific things I can do in the labor room to be most supportive? Are there any techniques, behaviors, or actions that actually make a big difference during labor?
So one of the a great question, because I do see the different dynamics of partners who aren't there, partners who come and go, and partners who are there throughout the entire process. And it is a dynamic between the relationship of the partners. Some partners are okay being by themselves. Some partners are okay for the partner to be there for the actual delivery. Um, but but it is key. The partner is there to help get things, because she may be bedbound, to help get certain foods or snacks maybe the hospital may not have, and you may have a plan where you may find better snacks that she can have. Um, During the pain process, understanding her lower back pain, the massages, warm compresses. We even allow TENS, where you could get the electrical stimulation of the lower back, has shown to help reduce pain and stress, helping her go to the bathroom. These are all the wonderful things a partner can do throughout the process. And encouragement of sleeping. Unfortunately, I see a lot of patients, they don't sleep and they're extremely tired when it comes down to pushing. So I do stress the partners, to encourage them to sleep while they're in the labor process, especially when they get the epidural and there's a moment of time of pain free, and the time for pushing is not there. I even come in and I explain to them this is the time to sleep. Close the lights, close the TV, close the electronic devices. I tell the nurse to lower the sounds and everything, and this way you can get some restful sleep. So right before the time of pushing time. So being there as a partner, things that you've already been doing, hopefully during the pregnancy, but the moment in labor and delivery, the key things to review is the massages, getting the foods, the snacks, helping go to the bathroom. These are all wonderful things to help her.
Great. Thanks so much. So I think that's all the